Welcome. Welcome to Informatics. This is the first of a series on health and public health informatics. I'm Rick Cates, and together with Grady Weaver, we are going to provide you an overview of the first 4 chapters of this book. First of all, an introduction to public health informatics, followed by a history and significance of information systems in public health, better health through informatics, and finally, the governmental and legislative context of informatics. The book describes public health informatics as a systematic application of information and computer science and technology to public health practice, research, and learning. This is very different than the analogy that the professor used when he talked about the butterflies. His was more of a pattern from start to finish. If we drill down, what do health professionals, or in this case public health professionals, need to know about health information systems? What are the change drivers? For example, public health reform. Think about Affordable Care Act, or growth in managed care, a way to reduce costs. We're pushing almost 20 to 30% as far as gross domestic product in terms of healthcare spending. And finally, the health information technology revolution. Think about electronic health records. Returning back to the conceptual map, the book says that data, information, and knowledge are often misused in discussions of informatics, but that it's important to have a clear understanding of the meaning of those terms so that the informatics process can be described completely. Data is the measurement or characteristic of the person or thing that is the focus of the information system, sometimes called the unit of analysis. For example, a public health assessor records the level of toxicity at a particular waste site. Information, data placed in context with the analysis. Going back to our example, the public health assessor creates a table showing the proportion of locations that have exceeded a certain threshold of contamination. Knowledge, the application of information by the use of rules. Going back again to our example, the public health assessor looks at action levels established by the CDC, for example, and then has a remediation plan that he puts into place. Let's try another example. A health organization records the number of HIV infections in the largest cities in South Carolina. That's the data. Information, data placed in context with the analysis. The health organization tabulates the positives at the various HIV clinics throughout the state. Along with the information from the HIV clinics in the largest cities, the researchers also evaluate the HIV cases reported at the area hospitals in these largest cities in South Carolina. And finally, the researchers look at the intravenous drug users and the treatment facilities that have reported HIV positive patients. Knowledge, the application of information by the use of rules. So they take in the 3 data sets that they have from the information that they're tallying and they've been tabulating. They then go and do a literature review. They look for benchmarks or precedents that were set based upon journal articles, and then from there take that knowledge, create a course of action or a remediation plan. Pay attention, because now you're going to have an opportunity to explain data, information, and knowledge. And the professor is going to post an assignment either on Blackboard or Cisco WebEx. So, the data that you're going to use or that you're going to explain from start to finish is ICD-10, which is a classification system that's derived from the International Classification of Diseases, which is developed by the World Health Organization to capture disease data. So why is ICD-10 so important to you? The reason is the naming convention that is used is how billing is set up or coded for reimbursement purposes. This is also the primary mechanism for reimbursement for Medicare and Medicaid. So, you as a manager need to ensure that your organization is being reimbursed for the services that they provide. As an IT professional, you will share in the struggle many organizations will face with the October 1st, 2014 mandate to move from ICD-9 to ICD-10 coding sets. Coming up next is a video, really an infomercial. We're not endorsing AAPC, but they are a leader in medical training coders, and they did a good job explaining what you will face as IT leaders.
By now, you've probably heard a lot about the transition to ICD-10 in 2013. But how hard is that really going to be? 2013 is a long way away, isn't it? Let's try to put the transition into some perspective. First, think about the codes themselves. Right now, ICD-9 has about 17,000 codes. Let's try to visualize that. 17,000 feet is about halfway up Mount Everest. 17,000 miles is about 3/4 of the way around the Earth. On the other hand, ICD-10 has 140,000 codes. 140,000 feet is nearly 5 times the height of Mount Everest. That's almost 6 times around the Earth. But the real problem isn't the volume of codes, it's the format. ICD-9 codes are 3 to 5 digits. The first digit can be a number or one of 2 letters. The rest of the digits are all numbers. ICD-10, however, has 3 to 7 digits, and they can be a big mix of numbers and letters. So why is this a problem? Well, can your computer system input 7 digits? And what about the systems that your computers interface with? So how will you upgrade? Which software will you use? How will you choose a vendor? How are you going to get trained on the new systems? Speaking of training, just learning the codes themselves will probably take 70 to 80 hours of training. Then you have to train your staff and everyone else in the office, the doctors, nurses, everyone, on the new changes to day-to-day operations. Will you need to develop new policies, new forms, new positions, reporting procedures, books, reimbursement policies, super bills, budget planning? How will you even know where to start?
Thank you for watching, and I hope you got a feeling for how valuable informatics could be for something as complex as the changes from ICD-9 to ICD-10. Again, thank you and good evening.